Hi, I'm Greg Dell, joined by attorney Cesar Gavidia and Stephen Jessup, and we're talking about long-term disability and short-term disability insurance denial reasons. And in this video, I want to focus on one of the juiciest areas of denials, which deals with medical support, more so the reason being the lack of medical support from a disability insurance company. And Cesar, I want to go to you first, and how do you usually see this when it comes from a disability insurance company where they're trying to use the lack of medical support to deny a disability claim?
Right. So that statement that your disability claim or your claim lacks medical support is being viewed through the lens of their medical, review team, their medical consultant, whoever they have that's reviewed all of these records that they have obtained, and you don't know if the insurance company's been the one that sought out the records. You don't even know if they have the complete set of records. So it's whatever the insurance company and their consultants believe is just lacking. Right.
And
so it's
dumb it down, back it up even further. Who are their consultants when you're saying that? Because people don't have any idea who that is.
Yeah. So it's funny because sometimes they never know or have any idea who that is. I just was done reviewing 2 denial letters for an insurance company that we deal with almost every single day. And all they did was refer to their consultants as the medical consultants. Indicated they were board certified internal medicine, indicated they were board certified pain management and rehabilitation, but never identified who exactly they were. So when we obtained the claim files, and we dug through the file, it was finally discovered who in fact they were. They identified these 2 individuals. And I was just wondering why don't they just come out and identify who these people are? Do they not want the insured, or if they're being represented by legal counsel, their attorneys, to know who the doctors were that reviewed the file? We have to go digging through a 1,300-page file to see who they are.
But were they employees of that particular?
They were employees, direct employees of of this insurance company. One was identified as the DMO. The DMO is the designated medical officer.
So is it the norm for disability insurance companies to, at least initially, review disability insurance claims with their own hired employees?
Yeah, I guess to justify their salaries, right? I mean, they're there, and that's their role is to do that. I think that's oftentimes the initial level. A lot of times they'll refer many of the reviews out to a vendor. Why do they do that? Because they want to give this air of independent of neutrality, right? Of they're an independent consultant. They have no ties to us. They're not hired by us. We reach out to this vendor. We don't even know who they are that they hire. So it's an independent, neutral review. So it doesn't appear like they have any skin in the game.
Right, but now you opened up the vendor box. Talking about that, a lot of people don't even know what you're talking about with that. So is this supposed to be a third-party company, and does the insurance company regularly work with them, or is it just random that they go?
Yeah, they've got a stable of these companies that they work with. There's, I think, MSC and a few others that they reach out to. Sometimes these folks, these medical consultants, are people that directly work for these companies. Sometimes they're in this kind of, I'm going to say Rolodex because it's what comes to mind, but I don't think we use Rolodexes anymore. But it's basically this massive file or network of physicians that they do this on the side to supplement income that they may not be making in their practice, or to make just generally more income, because it's very lucrative. It could be a very lucrative, occupation for them to do these medical reviews.
So it's normal for the companies to go to their own employees, or they'll go to an outside company and they'll do a paper review of the file. And then based upon that, these in-house doctors will say there's not enough medical support to support your allegations of being unable to do the duties of your job, or whatever the definition of disability is. Stephen, the other thing that we see all the time, and I see it in every other denial letter, is that your subjective complaints are not supported by the objective medical evidence. Most people who get that and see that for the first time in their lives have no idea what that means. Explain what that is, and why is the disability insurance company going down that road and using that exact language?
Yeah, so this idea of subjectivity calls into question character in a lot of ways, right? So if they're trying to say that your complaints are subjective, It's more this idea that there's no way for them to verify it, right? So when they look in the records and they say, well, the objective evidence that we think say you have pain, chronic pain issue, we don't see anything in your records that would rise to a level to the amount of complaints that you have about the pain. Those are purely subjective. Or they'll minimize objective findings. You may have MRI findings that show there's some disc bulges. So they'll be like, it's just a disc bulge. It's not a herniation. It's not impending the cord. But as we all know, pain is purely subjective. There's no way to verify the exact amount of pain someone's in, how it's affecting them. Pain affects everyone differently. So the insurance company loves to really prey upon this idea that, yeah, we understand you have it. We just don't think it's that bad, or it shouldn't be as bad as you're telling us. Because even when it comes to the doctor, your treating physician trying to give and lend support to your complaints, that doctor has to rely on your subjective complaints, right? So they really try to turn in this gray area and get away from what may be helpful or supportive, right? The insurance company is not going to give you the benefit of the doubt and say, oh, you're telling your doctors you're feeling this way, you have this discomfort, dizziness, fatigue, whatever the case may be. They're only looking within the context of those medical records. And that kind of segues into the problem with a lot of modern medical record keeping in these digital programs where if something isn't clicked, it kind of will go as like no issue or not a problem. So the insurance company will look like, oh, there's no issues on neurological exam, da 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 da. These just a list of things doctors go through in the note, and then they'll ignore what maybe the doctor types in at the bottom. Insurance companies always going to work for whatever favors them the most. Or, the reality of it is when your doctor fills out your, a questionnaire on your behalf and, add those questions about physical capabilities, a lot of times the doctors are even just trying to take a shot at it, and they get set up by the insurance companies. You're like, hey, we've reviewed it and we think that your patient would be capable of, sitting up to 6 hours, maybe lifting up to 10 pounds occasionally. Do you agree with that? Well, those are pretty minimal abilities. Most doctors would say, yeah, my client's messed up. That's about all they can do. Not understanding they're getting walked into this idea of, sedentary work capabilities. So I think a lot of what we do, especially when it comes to claim denials, is how do we give as objective evidence to the subjective complaint, right? What can we do to build up your complaints and show that those complaints are resulting in disability?
And that's a tremendous challenge to try to show that, because a lot of times disability companies only see objective evidence as certain things. They see it as MRI, they see it as CT scans, they see it as X-rays, they see it as any kind of physical manifestation that's like really obvious, like if you had scarring or if you had an infection or you had brain surgery, things that they can tangibly touch, or you had surgery, obviously. And then even after the surgery's over, they're like, okay, the standard recovery time is 3 months. You should be back to work. And after that, the one thing you said that a lot of people don't know, you said there's no way to measure pain. A lot of people never thought about that. There's no pain machine. It's not like going for an eye exam, and regardless if you couldn't even talk, the machine is going to tell you, can you see or not? You can't fake if you have vision or not. That's a scientific test. But there's no test in the world to say, Caesar, put your finger here, and I'm going to give you your pain level on a scale of 1 to 10. Obviously, if your bone's shattered and your bone's coming out of your arm, people would logically say you're supposed to be in pain. But other than the obvious things that people see, there's no way to measure pain. And at the end of the day, pain is always subjective, and that's where the disability companies try to really get over on people and say, well, your subjective complaints don't match the objective, because the objective is, the doctors say we treat the patient, we don't treat the chart. Because sometimes people come in with these horrible findings and the doctor looks at an x-ray or whatever and goes, how are you feeling? And the patient's like, well, I'm okay. And the doctor's looking at this scan or whatever going, I can't believe you're not having numbness in your hand or this shooting pain down your right arm, because I'm looking here and you have severe impingement. Then the next client comes in, doctor looks at the MRI, and the person's saying, my whole arm's numb, I got all this pain. And the doctor looks at the MRI and goes, there's nothing here objectively that shows. So why do you have that pain? But the last person who was in here who should have the pain didn't have the pain. So that's what we try to do, like you said, is to try to prove the evidence and use other tools to prove to the disability insurance company, yes, this person is having the pain that they are. And the first thing you said was it really comes down to the character of the person. And that's when the disability company tries to look at other things to try to say, you're not being truthful because you did this and we caught you on video or we caught you on social media or whatever those things. But Caesar, I want to come back to you because when clients call us and they say, and they've been denied, and they go, do you think you could win my appeal? And of course I say, look, I've looked at the denial letter. I think you probably have a chance. But ultimately, it's going to come down to the strength of your medical records. And why do we say that? And why is it so important, the way in which the doctors document medical records for a claimant?
Because the medical records and the medical support are your foundation. I mean, you can't build a strong house on a weak foundation. You can't build a strong appeal on a weak foundation. The medical records and the support in the medical records and the evidentiary detail really is critical. Unfortunately, we often have to, see records that are really lacking in that regard. It's not to say that the person isn't, struggling with some, severe impairments or disabilities. It's just that doctors are not trained. I don't even want to say necessarily it's a matter of training. It's just that they're not documenting your medical file most of the time to support your claim of disability. They're just documenting your file to be able to address your conditions and provide the care that they feel is necessary for your issues that you're coming in to see them for. And then to remind them why you're there the next time they see you.
That's the biggest thing, is what it is to say, this is what you told me last time, this is what I suggested you do. And there's also this relationship, even though a doctor might see 200 patients a month, but Caesar, when you come back the next time to see the doctor and you've already been there 5 times, hey Caesar, how are you? Oh, let me take a quick look at the notes. Oh, I remember you're here for this. This is what I told you last time. And it's just like that to build a relationship, because the doctor's truly treating the patient to try to get the patient to feel better or get under control, whatever is going on with the claimant. Not for the disability insurance company to document, can you walk, can you sit, how long can you stand, how long can you bend, how much can you twist. Doctors don't care about that. We just want to know what you, patient, are telling me. But disability insurance companies know that doctors don't document that way. And then they do what we call the cherry picking of the medical records and say, the records don't say this, that, and everything else, and therefore you don't have the medical support. So it's like this catch-22, because the doctors aren't working for the insurance companies and the claimants are destined for failure. When I mean failure, they're destined to get denied because almost every medical record doesn't have anywhere near the evidence that a disability insurance company wants. And that's where we have to come in and kind of not recreate this, but extract additional evidence from what's in those medical records and get the claimant to go back to the doctor to say, have I had all of these symptoms this entire time? Is it reasonable that the symptoms I'm having today when I see you, doctor, after they've denied me, were here 30 days ago or 6 months ago when they denied me? And plus we do other types, whether it's functional capacity testing or sending them for other objective evidence, whether it's MRIs, x-rays, or any other kind of blood work or any test out there. That's what we have to think about and really try to build the objective evidence to win this appeal and prove. And not just that we're doing that. For people who are watching this video and looking for tips, you have got to be proactive on the medical record documentation. You've got to look at your medical records every other time or every time that you go to the doctor. You've got to make sure that the doctor is putting in every single one of your complaints. Because while the doctor may not make some kind of objective finding like flexion, extension, bending, rotating, any of that stuff, but if all of your complaints are in there about the stuff that you can't do, then at least you told the doctor and it's acceptable that the doctor didn't do some kind of objective testing, because courts have always said the complaints were there and the symptoms were consistent. And if that's there, you're good. The problem is we see is that the doctor gets used to the claimant coming in and saying, yeah, my neck's stiff, or no, I can't sit for more than 2 hours. And the doctor's like, okay, I know that because you've been telling me that for the last 20 visits. Do I have to keep writing the same exact thing here? No, I don't do it like that. So these are the daily operations of a medical practice lead to making it easy for disability insurance companies to deny claimants, because the medical records are almost never that strong. It's just, it's sad, but hopefully people watching this video get that tip to say, you know what, I'm going to make sure everything that I have to do is in there. And whether I got to bring a pain journal or a log or just a list, say, doctor, please read this into the record every single time I come. And then that's puts the claimant in a much better spot to avoid denial, or if they have been denied, to get their claim approved moving forward. So if you're someone out there who's dealing with a long-term disability insurance carrier, feel free to reach out to Caesar, Stephen, myself, any of our lawyers. No matter where you live in the country, we're available to assist you, and we look forward to the opportunity to provide you with a free phone consultation.